Data from the Minnesota Department of Health shows childhood vaccination rates for kids up to 2 years old have declined in the past few years. KIMT News 3's Alek LaShomb spoke with Mayo Clinic about the data. And Alek, who do you speak with tonight, and why do they think that the rates have declined?
Well, Tyler, I spoke with Dr. Robert Jacobson, who is the medical director for the primary care immunization program at Mayo Clinic. He says he believes the pandemic is to blame for the decline in overall vaccination rates. In 2019, the childhood vaccination rate for kids was around 69%. Last year, that number dropped to roughly 63%. Jacobson says vaccines like hepatitis B and polio still have strong vaccination rates around 83%, and says the overall rate generally increases once kids go back to school due to mandated vaccine policies. However, he says he is worried about the measles, mumps, and rubella, or MMR, vaccination rate, which has dropped to roughly 78%. Jacobson says that number needs to be closer to 90% in order to prevent deadly outcomes.
Measles, on the other hand, puts children in the grave, puts children in the hospitals. That's a killer. And we are not at the rate of measles vaccination in Minnesota to really stop the spread of measles. We really want that rate to be closer to 90%, the kind of rate we have in our schools. But we can't afford for our daycares to have these lower rates. They're really putting all of us at risk for a calamity.
He says the way to increase vaccinations among kids is to make sure you are insured and for providers to communicate when vaccinations are due. Tyler.
All right, Alek, thank you very much. Now, Olmsted County also tells us that the vaccination rates for kids this month is around 67%.